Bright Light Young Advisory Panel Guidance to the designated hospitals on providing joint care for young people with cancer. Bright Light was the national evaluation of teenage and young adult cancer services in England conducted between 2012 and 2019. This was funded by the National Institute for Health and Care Research. Bright Light results were not available when NHS England updated the specification for TYA cancer services, and some results did not fully support what was being commissioned. In May 2023, NHS England released the service specification for teenage and young adult cancer care, which outlined the aims and responsibilities of the principal treatment centres and designated hospitals to deliver joint care for young adults aged 19 to 24 years old. But the key recommendations were for joint care between the TYA principal treatment centres and designated hospitals, referral to the network teenage and young adult multidisciplinary team within 7 days of diagnosis, screening with a TYA-specific holistic needs assessment, offered fertility preservation and sexual health advice. Bright Light had significant patient involvement through the Young Advisory Panel. We'd like to share with you how you can make sure young people receive the best cancer care when they are not in the TYA Principal Treatment Centre. Hello, we are members of the Bright Light Young Advisory Panel. Steph, Amy, Maria. We're making this short animation because making sure all cancer professionals know about the service specification for teenagers and young adults is important, and young people who have had cancer are the best people to tell you why. We've looked at the specification and we'd like to share with you how you could make our cancer care in your hospital better for us. We think the most important thing to remember is we're a young person first and a cancer patient second. There will be lots of things happening in our lives that we are also having to deal with at the same time. When we were told we had cancer, our whole lives changed. We need to be offered support and counselling to help deal with those changes. When we have a cancer diagnosis, it's important that you tell the teenage and young adult multidisciplinary team in your network about us. They look closely at our holistic needs, and some of this might impact on your treatment protocol, so the TYA team will be able to give you some guidance on the best options. Tell me about your cancer. This is what we're asked by every new professional that we meet. It's really tiring having to go over this again and again. This is why we need a named key worker. One person that we can rely on who can advocate for us across all the different departments, and sometimes different hospitals that are caring for us. If something really bad is happening to us, our key worker can make sure the doctors think about our whole life, not just our cancer. Our doctors might change during treatment, but our key worker will be with us throughout our journey. And when treatment ends, please have someone in the team who is available so we can still contact you and give us information on how we can do this. We want more information about clinical trials to understand why they are being done, so we don't feel like guinea pigs. Even if it doesn't work and we die, at least we know we positively made an impact for other young people. Additionally, please give us more information so that we can make this decision ourselves. And if it means we need to go to another hospital to take part, then let us decide. For example, a procedure before treatment could be the difference between having children one day with your own eggs and not doing, but we were too focused on making you better. Doesn't really make you feel any better when you're now 25 exploring fertility options and realizing they could have been saved, but this was overlooked. There isn't enough research being done that young people can take part in. We understand that one reason is our tumour samples are not always kept, which is making it harder to develop research and harder to get funding. There should be more banking options to make sure young people get the right treatment. Please make sure my tumour is banked. With your help, care can be improved for all young people with a cancer diagnosis, whether they choose to be cared for in England. Bright Light Final Report available. TYA Cancer Care Service Specifications by NHS England.